Hi, everyone. My name is Brianna Hansen. I'm a cardiology fellow at Vanderbilt University Medical Center and Cardio Nerds Academy faculty. I'm so excited to serve as Cardio Nerds Conference Scholar along with Dr. Ala Diab, Cardio Nerds Academy House Chief, for the 2023 Women's Cardiometabolic Health Conference taking place on the stunning California coast in Laguna Beach, California, August 17th through 20th. It is my great pleasure to be joined by co-chair Dr. Erin Michos. Dr. Michos is an associate professor of medicine in the cardiology department at the Johns Hopkins University School of Medicine, with a joint appointment in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. She is co-editor-in-chief for the American Journal of Preventive Cardiology and associate editor for Circulation. Welcome, Dr. Michos.
Thank you for having me on this program. And I'm so excited that the cardio nerds are attending our cardiometabolic health conference, focusing on women's cardiometabolic health and wellness later this month.
We are just as excited. And Dr. Michos, it is an honor to have you with us here today. Thank you so much for joining us and also for helping to coordinate this impactful conference. This is the third annual Women's Cardiometabolic Health Masterclass Conference aimed at exploring the differences in risk factors, symptom presentation, preventative strategies, and treatment for cardiometabolic diseases in women, as well as important implications for patient care. And not only will this conference cover many exciting topics, but it will host a multitude of experts in the field to share their science and learn from one another. Dr. Michos, what would you say you are looking forward to most at this upcoming conference?
Yeah, this conference is really special. This is our second conference. Last year was our inaugural year. And my co-chair, Dr. Pam Taub, and I had partnered with Cardiometabolic Health Conference specifically to create a program around women's cardiometabolic health because cardiovascular disease remains the leading cause of death in women. And women have unique cardiometabolic risks throughout their lifespan. And so this conference is really to help clinicians better care for women and optimize their cardiometabolic health. And we really take a life course approach. In this conference, we discuss everything from addressing cardiometabolic health in reproductive years, things like pregnancy and PCOS and infertility. We address menopause. We also address conditions that affect men and women, but differences in presentations and management in women, such as lipids in women and obesity management in women. We're also going to be talking about aortic stenosis and peripheral arterial disease and heart failure in women, and some of the differences, because sex and gender really influence everything about cardiovascular health. Biology plays a big role in terms of how patients respond to medications and how disease presents. And gender also plays a role in how women or female patients interact with the healthcare system, and potentially some biases in how women are treated relative to their male counterparts.
And going off of that, in your opinion, how do you feel like the field of women's cardiometabolic disease has changed over the years? And what do you believe are the key developments that have influenced the field and even hold potential for improving patient care?
Well, we made some progress, but we still have a long way to go. So I think we finally have realized that women are not just smaller men. I think historically, studies would enroll and study only men and then assume that those findings were applicable to women. And now we know that, even among traditional risk factors like diabetes and smoking and obesity and hypertension, some of these risk factors confer greater relative risk for cardiovascular disease in women compared to men. And then there's the unique risk factors that women experience throughout their life course that men do not. And I think there's increasing awareness around the impact of adverse pregnancy outcomes and early menopause. Even our recent ACC/AHA guidelines, prevention guidelines, have now identified these as risk-enhancing factors, these female-specific factors, along with things like autoimmune diseases that are more prevalent in women. So we're making a lot of progress, but there's still a long ways to go. Women continue to still be underrepresented in clinical trials. And, disease sometimes presents differently in women. In the setting of angina or ischemic heart disease, women are more likely to have, ischemia with non-obstructive coronary arteries, INOCA. So there's, increasing awareness in coronary microvascular dysfunction, but we still need more data, more studies about how to best treat these patients to improve their symptoms and ultimately reduce their cardiovascular risk.
Dr. Michos, you mentioned things such as pregnancy, menopause, higher prevalence of autoimmune rheumatic disease in women. How do you envision this conference will impact that current knowledge that we know of cardiometabolic disease in women?
Yeah, so we hope our conference will help enable clinicians to better care for women and understand their unique cardiometabolic risk and needs. And importantly, this conference is for everybody. So although this conference is focusing on women's cardiovascular health, cardiometabolic health, this conference, we welcome male clinicians to come. Men clinicians take care of female patients, and they need to know this information too. And sometimes when we put on a conference focused on women's health, that only women clinicians come, but this conference is for everybody because we all take care of female patients. What's also unique this year is through partnership with Women as One and through a generous educational grant from Amgen, Cardiometabolic Health Conference is able to now sponsor a training program called the Future Leaders of Cardiometabolic Health. So we will have spots for 5 trainees, residents, and fellows who will be able to come as our cardiometabolic health scholars and have their conference and travel covered for both this conference and also the Cardiometabolic Health flagship conference in Boston in October. And there's going to be special activities for the trainees because we really need to train the next generation of clinicians to help better care for female patients regarding their cardiometabolic health.
I love that. That's such a great action item to not only increase recognition of this, but to also set forth training and practical ways to get clinicians more trained in this. As well as that, what do you think are some areas for future research and improvement that you see will come from this conference to drive some positive change in patient care?
Yeah, so I hope clinicians walk away from this conference with some unique understandings of some of the nuances of care of female patients. I want to note that this conference is special and near and dear to my heart because it's not just about the education, which is so important, but also we have sessions about professional growth. And so there's activities and sessions and panels around overcoming professional challenges and resiliency. And last year we had a special session on how to break into clinical trials. And so there's also more career development and professional sessions. We also have a lot of opportunities for networking for trainees and early career and maybe individuals who are in private practice that might want to be able to network closer one-on-one to some of these real thought leaders in the women's health field. So there's lots of opportunity for networking. And of course, I can't forget that something also near and dear to my heart is the wellness activities, because we all can't pour from an empty cup and we can't take care of our patients unless we take care of ourselves as well. So we've always also built into this conference some special activities like an early morning sunrise yoga. And we're bringing back Zumba again, which was a lot of fun. It was co-chaired by the one and only Dr. Christy Ballantyne, who is a leader in the cardiometabolic and lipid field. And so it's fun seeing people let loose and have some fun and doing a fitness activity. We also have a beautiful 5K walk, run around the property. And of course, this conference is set in beautiful Southern California, Laguna Cliffs, right on the Pacific coast, so that hopefully everybody can take some time to nourish their souls and take some time for wellness, in addition to getting updated on all the latest information about women's cardiovascular health.
Well, as a Southern California native and an early trainee, I'm so excited to be able to combine going home for this wonderful conference and having that professional development and also doing some yoga. I'm very excited that I get to combine all of those things together. And before I let you go, I just wanted to touch on one more thing. So the American Heart Association has granted additional funding for research at Johns Hopkins and at Morgan State University to address the lack of diversity, equity, and inclusion in clinical trials for medical research. And Dr. Michos, as a principal collaborator, what is your vision for how to use these resources to drive forward health equity for both women and people of color?
Yeah, so this has been a real problem, and I've published a lot on this, as has others, that, historically women continue to be underrepresented in cardiovascular clinical trials, with some exceptions. Historically, female participants only make up about 25% of trial participants. And so, if a drug or an intervention is successful, we need to know whether though that also benefits women as well, equally as men, in terms of both efficacy and safety. And without adequate enrollment, we don't know if the results are generalizable to all the patients that we take care of in clinical practice, not only female patients, but also persons of color and from underrepresented racial and ethnic minority groups. So this has been a big problem. And the American Heart Association has launched what they call a strategic focus research network. They funded 5 centers and also a training center for fellows to study the science behind improving diversity in cardiovascular clinical trials. And so hopefully all together, we will come up with some solutions to help move the needle forward. Our particular grant has both a community arm involving community research councils and community engagement. We also have a digital arm, so more to come on that. And then another thing that's been near and dear to my heart is having more female investigators, clinicians on steering committees for these cardiovascular clinical trials. Some of my own studies have suggested some correlation with more women authors involved in the steering committee actually having, those trials higher enrollment of female participants. So Women as One, also, this is something very near and dear to their heart. And so we also want to train and empower women and giving them the skill sets to become investigators and trial leadership so that they can help lead and run some of these trials and help design trials that address cardiovascular issues in women and help enroll women and other diverse populations into these trials.
That's amazing. I'm so excited to see where this research goes. Thank you, Dr. Michos, so much for your time today. I cannot express how honored Ala and I both feel to be representing cardio nerds at the Women's Cardiometabolic Health Masterclass Conference. And for our audience, please be sure to follow the Cardio Nerds Conference Scholars along for key takeaways from your favorite conferences.